your case.
Thank you very much. And Deputy Ferris has more time then. Yes, yeah. Okay, well, first of all, Minister, the issue at hand here is the Friends of Kerry University Hospital have raised millions of euros for the hospital back over the years. I want to commend those people. Deputy Martin Ferris knows them as good as I do. They're ordinary, decent, hard-working people from Tralee and from all around the county of Kerry who have supported the hospital through the umbrella of the Friends of Kerry University Hospital. They've done Trojan work. They've done work and picked up what I'd call the slack for this government and previous governments who have left them down. And they've raised millions of euros for much needed equipment for our hospital in County Kerry. But one of the things that they provided funding for was a scanner. It's a Dexa scanner. Now that scanner, unfortunately, it was manned for a while, it was staffed for a while, but now it lies idle. Patients have to travel to Cork or to pay to have their scans done privately in the Bond Secure Hospital in Tralee, which we're very grateful that the Bond Secure Hospital is there as well, and they provide an excellent service. But again, why have we this vital piece of infrastructure, this vital piece of medical equipment lying idle while this government and the Department of Health, the department that has so many ministers, yourself included, Minister, much and all as we may like you, that you nearly want to stick to wave at all the ministers for health we have, and at the same time, with the mismanagement that is going on, with the taxpayers' money, we can't staff that piece of vital machinery that was paid for by fundraising and by the Friends of Kerry University Hospital. It has lied idle for 4 years. There has been an action by this minister and previous ministers in the HSE. It is disgraceful and disrespectful to the people of Kerry and to the staff of the hospital, who would gladly man it if they were allowed to do so.
Minister, the importance of a Dexa scanner, particularly for women, with middle-aged women, it cannot be stressed highly enough. It measures bone density of people, and obviously I was looking at some of the statistics regarding bone density and the importance of a DEXA scanner, particularly in relation to fractures. And what I discovered was fractures within middle-aged women in particular exceeds all other diseases. It's twice more likely to have a fracture than a heart attack, 5 times than cancer, and 8 times more likely than having a stroke. And the value of that scanner to Kerry University Hospital is immeasurable. In the 4 years that it's idle, but the years prior to that, the first year in operation, I think it had done 202 people went through Dexa scanner. 290 people went through the last year in operation, that it was in operation. And currently, I'm told there are 800 people waiting to be scanned by the Dexa scanner. And again, like Deputy Healy-Rae says, that the Friends of Kerry University Hospital, the amount of money that they have raised, they bought that scanner for the hospital. They put that scanner into the hospital. And what is needed here is a radiologist to be made available by the Department of Health, so as those 800 people plus can get the scans that they need in order to give them that rights and entitlements. Having to go to Cork or go private is not an excuse. It should not be the case. I have spoken to the Kerry General Manager. Deputy Healy-Rae spoke with him as well on this issue. We have raised it at meetings that we were at, that the necessity for it, and each time we said we've been told they don't have the personnel to run it because the funding has not been made available for those personnel. So I would urge you to give it immediate consideration.
4 minutes to respond.
Last Concordra, first of all, can I say that I'm taking this on behalf of Minister Simon Harris, and can I also thank Deputies Michael Healy-Rae and Deputy Martin Ferris for raising this very important issue. And of course I want to welcome you all back after the summer recess, because it does give me the opportunity to provide an update to the House on the Dexa scanner at University Hospital Kerry. At the outset, can I say, Alaskan Corla, I would like to agree with my colleagues and acknowledge the tremendous efforts of the Friends of University Hospital Kerry, which have been instrumental in encouraging charitable contributions from the community towards the work of the hospital. and I would like to thank them most sincerely for the provision of the scanner in 2015 to meet a growing patient need. The HSE has advised me that despite numerous national and international recruitment drives, University Hospital Kerry has been unable to recruit a full complement of radiographers to provide Dexa scanning services. However, I do understand that University Hospital Kerry is currently interviewing the basic and senior radiographers, and the hospital hopes to appoint staff within the coming weeks, following which the hospital may be in a position to consider re-establishing the service. The hospital is also seeking to identify suitably qualified staff other than radiographers to undertake training in the operation of the Dexa scanner. Furthermore, other options, including potential outsourcing, will be considered. It is important, to note that the challenges in the recruitment and retention of radiographers is not specific to the University Hospital Kerry, but is also reflected right across the country. Following decision in 2016 to conduct a national review, approval was obtained in September 2017 for the Department of Public Expenditure Reform to appoint an independent chair to conduct this review. The terms of reference for the review include a wide range of issues for examination, including retention and recruitment. It's also important to note that this review will not examine issues related to pay which are being addressed by the Public Service Pay Commission. A series of site visits concluded in early 2018. The purpose of these visits was to gain greater understanding of the day-to-day issues which are the cause of concern for the radiographers. It is expected that a draft report containing recommendations will be agreed by the review group in the future. Furthermore, it is important to note that the radiographers are one of the healthcare professional groups being examined under Module 2, Phase 2 of the work being undertaken by the Public Service Pay Commission. This group was identified for further examination as evidence of recruitment and our retention difficulties were found to exist during the work undertaken as part of the Commission's work for its first report. The report of Module 2, Phase 2 is due to be published in the coming weeks. Thank you, Alaskan Corla.
And I suppose most importantly, I thank you for acknowledging the Friends of Kerry University Hospital. But to the 800 people who are waiting, if I thought that this was going to be factual, and if I thought that in the next couple of weeks that the scanner was going to be up and running, and that these people wouldn't have to be waiting and looking to go to Cork or paying for it in the other hospital, in the Bond Secure Hospital in Tralee, of course I would very, very warmly welcome that. And if that can be the situation, and if this machine can be put to its full potential and full use, that would be most welcome. The one thing that I would advise you, Minister, in a common and ordinary and sensible way, could I ask you to take a leaf out of the book if you see the amount of people I'm taking to Belfast on a regular basis to have cataracts removed from their eyes? And when we see surgeons coming in on a Sunday to carry out operations, scheduled operations, where they'll go through a busload at a time, why can't we do that here in the Republic? Why can't we operate our hospitals in that type of a way and use the machinery that's there and use what we have to service the people and to reduce our waiting lists?
Minister, thank you for your reply. I think I've read this before. I'm just looking at the answers, and I raised this question here in the past, and something similar answers I've been getting. And hospital hopes to appoint staff within the coming weeks, and may be in a position to reconsider the service. Like it's typical civil service speak. There's no substance to it. I'm just, the hospital is seeking to identify suitable qualified staff. Like, this is ongoing for 4 years. And I can't understand how in the last 4 years that the HSE and the hospital were not able to identify suitable staff and appoint them. And it's like, as we said, the list was when you had 202 and 290 in the first two years of operation, and the list has grown to over 800 now. I hope that what's in this comes to be in the next coming weeks, but I've heard it all before, Minister. And I think both Deputy Healy-Rae and other Kerry TDs who have met with the hospital management over the last number of years would be in a position to vouch for what I'm saying here.
Minister.
Of course, I fully understand the local frustrations from Deputy Michael Healy-Rae and Deputy Martin Ferris, and when it comes to the 800 people you're referring to, absolutely. And the fact that the Dexa scanner has been provided from the voluntary donations of the people of Kerry cannot be used due to a shortage of radiographers required to operate. And I understand your frustration and annoyance on that one. The HSE advised that the hospital is engaging with the Friends of the University Hospital Kerry in relation to progress, and the hospital is extremely grateful for the tremendous fundraising work which this foundation has carried out. I encourage management at University Hospital Kerry to work quickly to progress local solutions to this issue, and I look forward to the outcome of the National Radiographer Review and any recommendations that will promote the recruitment and retention of radiographers in the Irish healthcare system. And of course, I will bring your concerns raised today here back to the Department, the HSE and the Minister Simon Harris. Thank you.